Dr. Amber got to start with you here this evening. I'm going to introduce myself. I'm Dr. Mouw. And what I'm going to do this evening is really explain to you why we do what we do in this office. It's almost 8 years now. My wife, Dr. Lynn, and I opened this office. And hopefully from what you see from our first couple visits you've had in the office is our real dedication to what we do is to express to our patients a better way of health. There might be some issues out there that you guys have seen in our healthcare profession. Unfortunately, it doesn't deal with healthcare, and I think Dr. Amber expressed some of those as you're shaking your head like, yeah. I totally understand what you're talking about because we see it every day. So what I'm going to do is we believe there are 5 health principles that everybody should understand about their bodies and how they work. So my job tonight is to express those to you and help you understand, if you don't already, how your bodies can be healthier. Cool? So principle number 1 says this. Our bodies are self-healing and self-regulating. Guess what? You were born with the ability to heal. You were born with the ability to function correctly. Your body was born with this education to understand what to do your whole life. All right? If you get a paper cut, guess what happens? It heals. Yeah, it heals on its own. If you break a bone, guess what it does? It heals on its own. And that's the awesome part. Now, if we need stitches to make the scar look a little prettier so it's not as ugly, or we have a cast that's put on so the bone actually heals straight and maybe not out of alignment, those things don't heal us. They just make us cosmetically look better. But they would heal if we didn't have them because they used to hundreds of years ago, correct? When they didn't have those things. What controls all of this healing and functional process but our nervous system. And that nervous system consists of our brain, our spinal cord, and the nerves that come off of it. When this guy can work correctly, you can work correctly. And we're going to get into that a little bit more as we talk about principle number 2. And it says that the nervous system directs and controls every cell function in the body. There are 140 trillion cells that make up your body. What is so amazing is that from the day that you were conceived, an egg and a sperm. Those of you who are moms, and those of you that are dads in the room, dads gave a sperm, mom gave an egg. When they touched, I know immediately there was what? Life. Why? Because in the first day, those 2 cells combine and they start to do what already? Multiply. And this innate intelligence that's there starts up already when that egg and that sperm touch, and it starts to differentiate cells. And really the first organ that's developed in a human baby is what? Actually all mammals, but what? The brain. And then the brain controls it the rest of the way. And the crazy awesome thing is that 2 cells in 9 months do what?
Build a body.
Build a body. It's so amazing and so awesome. But did you know that cells die and are replaced in your bodies every day by the thousands?
Oh, yes.
You use them and they wear out, and guess what your body does?
Regenerate.
It makes more. All right? What do you think the shortest living cells in your body are?
Skin.
Skin cells? They take a little bit longer than the shortest. Did you know the skin's actually the largest living organ in your body?
Yes.
It is an organ. It's breathing, it's functioning, it's being replaced all the time, but it's not. The shortest living cells in your body are actually the stomach cells. Because of the hydrochloric acid, the HCl in your stomach, there are 14 layers to your stomach that continue to make mucus to help keep the stomach protected. Because if you took the acid out of your stomach and took a drip and put it on your hand, it would be strong enough to start to go through your skin, the soft tissue, and even into the bone. That's how strong it is to break down the foods that we bring into our bodies. So literally 3 days is as long as the stomach cells actually exist. Red blood cells? They're replaced about every 120. The red blood cells are the cells in your body that bring oxygen. Okay? So what we see is that when these guys are replaced on a regular basis, that's a good thing. Now, which cells in your body do you think live the longest? What are we dealing with in here? What system? Primarily when we're adjusting you? The nervous system, yeah. And here's the situation. The nervous system, the cells usually last the longest. They say in research that the nervous system cells last 9 to 12 months. There are some brain cells that will live forever. They're the same ones you're born with as the ones that you'll die with. Okay? That's really, really important. But the awesome fact is this. 1 year, literally 1 year from the day, you're going to be a what? A new and different person. The thing is you have a choice. You have a choice if that's going to be a better person or a person that is not as good or more unhealthy? I put it to people like this. Would you agree with me that nutrition, your diet, has a lot to do with how healthy your body is?
Yes.
Yeah, we're going to talk about it in a little bit. The food you put into your body is what replaces the cells. So the better fuel you put into your car, the better and the longer it'll run. Well, the better fuel food that we put into our body, the healthier our body will be. So if I eat McDonald's for the next week, what's my body going to be made out of a year from now?
Good.
McDonald's, which in essence is a much less healthy food than if I were to eat salads, if I were to eat healthy proteins, if I were to put that fruit and those vegetables in my body on a regular basis, because those are the things that actually make my body what?
Work better.
Stronger, function better, and be healthier. So literally, we can't blame it on, genetics. They're actually showing that genetics has less than 5% of the overall health. It may predispose you, but that doesn't mean you're going to get it. That means if you make the right choices, you will never express those genes to actually cause heart disease or cancer or whatever else. Pretty cool stuff, huh?
Yeah.
We can't blame it on our parents. Mom, it's your fault. We can't say that anymore. It's actually a decision that we need to make. Cool? So with that in mind, principle number 3 says what? Our cells are innately and genetically equipped from birth with all the necessary intelligence to function properly. What's innate intelligence? We just started talking about that word. The doctors probably talked with you maybe day 1, day 2, and talked about the innate intelligence, but we need to understand this. And the definition of innate intelligence is this. It's the force within the body originating from the brain and spinal cord that controls all functions and procedures, including healing and proper health, unless impaired, interrupted, blocked, or trapped. So let's talk about innate intelligence, the force that's within our body. Okay? Remember we talked about the egg and the sperm touching? We said there's life. Well, guess what? That life is the innate intelligence. All right? I'm a God-fearing man. To me, that innate intelligence is the soul. To people who believe in Buddha, it might be something else. People, there's might be Mother Nature. I'm not talking about beliefs. I don't want to go there. But what I'm saying is all of us understand that when we're alive and on earth, there's something running through our body, and it's an electrical current. Okay? What's the difference between my body here and 10 foot under? This innate. It's the only thing different. Are you with me? And it controls everything. And when it can be expressed through your body properly, all functions and procedures, including healing and proper health, unless impaired with, interrupted, or blocked. What's this impairment or interruption or this blocking thing that we talked about on your first or second visit? Starts with an S. Remember what it was called? Bring back memory?
Yeah.
Subluxation. Vertebral subluxation. Okay? So subluxation is this blocking of the message of the innate intelligence of the body for your body to be healthy. Okay? But now what's innate intelligence? What's subluxation? What does medical definition mean? It says it's dysfunction, biomechanical, spinal segments, or lesion, they call it, that actively alters the neurological function, which in turn leads to neuromusculoskeletal and visceral disorders. Blah, blah, blah. I see your eyes going like, what are you talking about? Let's break it down. Okay? This is the medical definition. Let's tell you what it is. So it says it's dysfunction, right? Is dysfunction good or bad?
Bad. It's bad.
Bad, okay? So it's dysfunction of a joint. All right? You see the spine laying there on the floor. I'm not even going to pull it up. Everybody kind of understands what a spine looks like. I'm going to bring out the model you guys saw the first time. And this is actually just 2 of the segments of the spine. And this is a segmental joint. When they talk about a spinal segmental joint, they're talking about one of these. You have 24 of them that make up your spine, plus the sacrum and pelvis. Okay, so there's really, there's 24 segments of the vertebrae. There's 23 joints plus the sacrum and the pelvis, which is 2 there. So really we have 25 different joints in our spine that make it up. Okay, but when the nerves function correctly, and this goes to your heart, lung, liver, kidneys, back over to your, down into your big toe, green is good, 100% function. 100% of the innate intelligence is going from the brain out to the body. Guess what you are?
Good.
Good and
Healthy.
healthy. That's a huge point. This is health. Okay? A lesion or altered function is a subluxation. Watch. Here's a subluxation. Less than 1/8 of an inch of movement of a vertebrae out of position due to something I'm going to talk about in the next slide. But it's a movement of subluxation, movement of the joint out of position. What's healthy? Regular movement. What's unhealthy? Lack of normal movement. And what do you think happens to that nerve?
It doesn't get through.
It becomes impinged. But maybe it's impinged 5%. So 90% of the information from the brain is going out to, let's say, your liver. Is your liver 100% healthy? Only 95% is going there? No. But do you know it? Usually not. Guess when you know it? When the nerve decreases in function by over 50% in most cases. That's what usually brings on the pain response. And pain is nothing more than the symptom in your body going like, okay, I can't adapt anymore. I'm going to give you pain because your body's altered in health so much, I'm going to give you symptoms. And some of that Dr. Amber talked about. So what's it alter? Neuromusculoskeletal. Neuromusculoskeletal means nerves and muscles. Okay? So, I don't know what you came in with, but I'm just going to say, you came in with neck pain, you came in with headaches, and low back pain. Okay? There are issues. Neuromuscular. Everybody understands like nerve and muscle. Yeah, it messes with my spine, right? Everybody understands those things. What's visceral disorder? What's viscera? I want you to take a look to your guys' left. And we're going to go to this poster right here. Guess what viscera is? Viscera? Is your organs. I got a question for you. Does your nerve control your body doing this?
Yes.
Yes. Does the nerve control your body from winking?
Yes.
Turning your head?
Yes.
Lifting my knee?
Yes.
And like, it does all that. Well, guess what controls your heart function?
Your nerves.
Your nerves. Do you think about... guess what the heart is?
A muscle.
It's a big muscle. That's all the heart is. It's nothing more than a bicep. It just pumps blood. Your lungs, just two big sacs. What tells you to breathe? The nerves do. You don't have to go, okay, beat, breathe and beat. Most of us would live for like 10 seconds because I'm not very like multitask oriented. I can do one thing really good, my wife says, at a time, right? I would probably die in 10 seconds. It just doesn't work that way. Guess what does? Your nervous system's innate intelligence tells your body how to operate. And when you get subluxation, guess what your body does? It compensates. It generally adapts to what's going on in your environment so you can live as less stressed as possible. Well, what causes these problems?
Nerves. Pinched nerves.
Yep. But what causes subluxation? Stress. What causes our body to break down over a lifetime? We talk to our patients all the time. What causes us to go from womb to tomb that our bodies break down? Stress. That's it. There's nothing else in any category that causes our body to break down other than one of these three stresses. Physical stress, chemical stress, and emotional stress. They are the ones that cause subluxations in your life over a time. I have people who come into my office all the time and it absolutely drives me somewhat bonkers. And I have it probably on a weekly basis. They come into my office at 40, 50, 60, 70, 80 years old as a new patient. And guess what they blame their problems on? Old age. Dr. Mark, I'm just getting old. And I said, that's baloney. I said, it's not that you're getting old. You just have less ability to adapt to the environment around you. It's not that old age is catching up to you. Because I asked them, what did you do in the last 10, 15 years that caused your problem? Well, I don't know. I've actually been doing pretty good to myself. What did you do the first 25 years of your life? Like, oh, doc, I jumped out of hay mounds and I wrecked four-wheelers and I played sports and I fell off of this and I had a car accident. What do you think breaks down our bodies? Stresses. And it's not that we get old. It's that the accumulation effect catches up to us. Does that make sense? People all the time, oh, I'm old.
Snowball effect.
It's the snowball effect. I love it. I use that all the time. Little snowball up here, but as it goes down, guess what? It gets bigger. And it has a bigger effect on our body. And that's what these stresses are causing. Emotional stress. How many of you guys have work stress, family stress, financial stress, hectic schedules?
I got 3.
Everybody's like, whoa, I got 3, I have a husband, I have a job, I have this, I have that, I sit at a computer all day. How many guys wish you had the Staples easy button?
Yeah.
Oh, I'm going to take that, I'm going to hit the easy button. Everything taken care of. You know what's the hardest thing to take out of my patient's life? I can stop them from digging a ditch. I can keep and give them stretches to do in front of a computer. I can get toxins out of their body by helping them get off of things that they're on, that they probably shouldn't be on, that's breaking their body down. Guess what the hardest thing to take people away from?
Work.
Emotional stress.
Oh, emotional.
Yeah, emotional stress from work. Maybe a boss or coworkers. It might be a husband or wife or significant other or relatives. It might be holidays that are coming up. It might be finances. It might be 3 kids. Who knows what it is. But guess what they do to you? Stress you. Emotional stress is the hardest one to take out of your lives. But it's the one we need to deal with the most. It's the one we need to be really healthy with. Okay? Chemical stresses. Alcohol, nicotine, environmental toxins. How many of those are out there? Air and the water and stuff that we have. Processed foods. We talked about McDonald's earlier. It's really not food. It's just a bunch of stuff that's processed. It's really not good for our bodies. It has harmful effects. And then drugs, illegal and legal. Dr. Amber talked about some of the drug things that are going on. We are absolutely being drugged. I was at a workshop a week and a half ago with one of the leading experts in the wellness field. His name was Dr. James Chestnut. And Dr. Chestnut was talking about some of the figures that are scary. He was saying that in the United States, we take 63% of all drugs prescribed in the world. But yet we are less than 5% of the population.
Doctors diagnose over the phone instead of seeing them in the
And at times, yes, that occurs. And then we start to talk about the average American community in the United States today. We take 50 million pills per hour. In the United States, we are being overpilled. But guess what our life expectancy is compared to the world? Where do you think we rank?
The lowest.
We showed you. I'm not sure if she sent that
Yes,
around. She sent that magazine around. I mean, like, that's National Geographic going like, we have huge medical expenses, but our life expectancy in the United States is 47th in the world right now.
Yeah.
There's 40. I can't even name 46 other countries. Probably, if you sat down and gave me a list, maybe I could. But I'm just saying, we'd have a hard time picking 46 other countries. But there's 46 other countries healthier than we are. We have more pills, drugs, and medications we've ever had today. Pretty crazy, huh? Think those things cause our body to break down? Of course they do. Physical stresses, car accidents, sports, repetitive stress work, sedentary work. We were made to move. We were made to run and move and walk and shift and all those kind of things. Okay? When we were hunters-gatherers back 10,000 years ago, the average human being, where our genes haven't changed much in 10,000 years, by the way, we are the same people we are now as what we were then. All right? We were people, we were Homo sapiens, we were standing upright, but we were hunter-gatherers in small communities. The average person walked 10 miles a day and ate 8,000 calories a day to stay alive.
Metabolism.
Now the average person walks 8,000 steps a day and still takes in 4,000 to 5,000 calories a day. Do you think we have a problem?
Yes.
And then the food we take in is just calorie and fat producing, nothing that's actually healthy. And then normal childbirth. Why do we adjust babies? Dr. Amber talked about some of her passions adjusting kids. We had one of our gals who gave birth on Wednesday last week. Her child's getting adjusted for her first time on this Wednesday. Why? Because the birth process is when 90% of us become subluxated the first time. Imagine that baby's body, 7 pounds, going through the pelvis. That's a little hole to bring a baby through. We don't think about it that way, but it's hard on the baby too. Principle number 4 says this: all dysfunction in the body is directly or indirectly related to nervous system interference. All right? Where should subluxations cause problems? Where can subluxations cause problems in your body? We just talked about it. Anywhere. If a nerve is compromised, if one of these 54 nerves is compromised, if one of these 54 nerves that's compromised that come out of your spine, sooner or later there's going to be a problem because it's being compromised. Our body wants to work at 100%, but it can't. Do we know what these subluxations occur? No. We don't have any idea in most cases. You ladies, you guys come into the office and you're like, okay, I have this and this and this. But when did it start? Oh, it started to hurt really bad last week. Well, when did you notice the first sign? Oh, 15 years ago. All the time. Well, what's gone on? It's just festered and got worse and so forth. Subluxation causes many different symptoms that can be causing immediately or over time. We talk about babies, ear infections, bedwetting. We had a 13-year-old boy come in with bedwetting problems. Literally in 2 adjustments, his bedwetting was gone. What do you think he had? Nerve compressed going to where? The bladder.
Pinched nerve.
Pinched nerve. He was on drugs. He wouldn't go to friends' house because he couldn't stay overnight because he was wet in the bed. It wasn't his fault. The nerves were being pinched, and they'd been pinched forever. Colic. How many moms are going like, woo, I wish I would have known about that. Colic is usually a misalignment of the vertebrae.
Really?
They usually stop within 4 to 6 months, and the reason why, guess what their body does? Adapts to it. Exactly right. Asthma, allergies, poor immunity, acid reflux, constipation, sleeping problems, fatigue, headaches, arthritis, joint problems, sciatica, numbness, tingling, carpal tunnel. This is just a short list. You guys are blown away by how much your bodies could actually function and work correctly. What do we need to do? Do we need to have symptoms to have subluxation present? No. Why? Because subluxations exist and they progress throughout a lifetime. That's why we adjust kids in the office. Number 5, specific chiropractic adjustments to help restore function by removing nervous system interference. Why do we adjust you? To remove pain and restore health.
To fix the alignment.
To fix the alignment. We in this office, myself, I'm just going to say, I've never adjusted a person for pain. The reason why? Because I'd be chasing it around. I'm adjusting people for subluxation to allow your body to do what?
Yeah. Restore itself.
Restore health. Restore health. It's restore itself. I can't heal you. I can't heal you. I can't heal you. I can't heal anybody. Guess who heals you?
Yourself.
Your body heals you. As long as the interference is taken away. All right? Chiropractic adjustments release subluxated areas in the spine. What will happen when interference to the innate intelligence is removed? I say, you know what? You know what one of the side effects of chiropractic adjusting is?
Healing.
Healing. Terrible side effect, huh? Healing the right way. Letting your body do it instead of trying to put a pill, drug, medication, or surgery to it. We are so powerful on the inside. Our bodies are so amazing. Your innate intelligence inside of you created you in 9 months. Created you in 9 months. Do you think it can take care of you the next 100 years of your life? Yeah. It just needs to take care of you. It just needs to make a few thousand cells. The problem is that man can't make one cell. They can't make a human cell. You get all the smartest scientists in the world together in a room, guess what they can't make? A cell. Our bodies do 10,000 of them a day on average. Who do you think should heal you? Man? Do you want me to heal you, or should I let your body heal you?
Body.
Exactly. The last thing I want to talk about is this. It's just not all about chiropractic. We express there's 5 things in our life that we need to do. Number 1, we need to have a proper diet, toxin-free. Get the right foods to put into our body to function correctly. The right foods make a right body. The wrong foods break our bodies down over time. We need the right mental attitude. We need to be positive. We need to do meditation and yoga and Pilates, and all those things are great, but just have a positive attitude. People ask me all the time, oh, did you hear the news? And I said, nope. I haven't watched the news for probably 6 or 7 years. Why don't I watch the news? Because if I get up in the morning and listen to negative stuff right away in the morning, because the news is just what? Negative. It's always negative. Someone's getting killed or shot. When they put a news station out that actually is positive news, like so-and-so donated this much, and so-and-so rescued the cat down the street up in the tree, I will watch it. And it's negative before I go to bed. Why would I want to watch something that's negative before I go to sleep? Because guess what my body's going to heal with? Negativity. So positive mental attitude. Number 3, exercise. Study out of University of Minnesota took 12,000 men over 4 years. And what they did is half of them, 6,000 men, walked 20 minutes. That's it. Walk 20 minutes 3 times a week. And at the end of this study, they actually did research on that 6,000 men compared to the 6,000 men who did nothing in exercise. The men who walked were 41% less likely to have heart problems. Wow, exercise is important. Proper rest. Guess what your body does when you are sleeping?
Heal.
You heal. It's the only time you heal. When you wake up in the morning to the time you go to bed, your body is breaking down. Why? Because we're using it. Okay? And if you are sleeping because of a medication to put you to sleep, it doesn't count. It needs to be regular rest. And one of the things you'll notice as you start to get adjusted, what's one of the first things you'll start to notice? Most people are like, wow, there's this crazy side effect that's happening. I'm actually sleeping much more. Is that a good thing? Like, yeah, guess what your body's doing? It's repairing itself, which is an awesome thing to happen. And once the last thing is proper nerve supply, that's the reason why you guys are here. I hope you guys enjoy what you're listening to tonight and you understand it. We can continue to build on that. Dr. Jamie's going to come back in a minute here. He's going to finish up about what we really do and go through the processes in our office to get you better. If you guys ever have any questions, make sure you tap us on the shoulder. We can always slip back, go into a room, talk about the things that you want to, but our goal is really just to get you healthy again.
Okay.
Okay?